Let's bring on Dr. John Chessare, who's president and CEO of the GBMC healthcare system. Always a pleasure, sir. Great to have you on. I guess let's start with numbers. You know, where are you in the scheme of things when it comes to COVID patients and on the vaccination level as well?
Yeah, good morning, guys. So we're kind of holding our own. We have 24 COVID-19 positive patients at GBMC today. So we're in that plateau that we've been in for a while, and we know that the state numbers of hospitalized patients is inching up a bit, but we're ready if we get even more patients. On the vaccine front, we are now immunizing. We're giving about 300 to 400 doses a week, which is many fewer than we were doing about a month ago. And that is because the state is directing the supply of vaccine to the large community centers, and the hospitals are getting fewer doses.
We're speaking with Dr. John Chessare, once again, President and CEO of GBMC Healthcare System. It is our town hall, virtual town hall, in a series that we have had with GBMC. And we've talked a lot, Dr. Chessare, about people getting elective procedures, having tests like colonoscopies. How has that improved, or what are you seeing now?
Well, we're very happy to report that people are coming back for their preventive health care, and colonoscopies in particular. We've and thanks for having us back again, guys. But we've discussed in the past that colonoscopy is maybe the most effective screening procedure that is out there. We know that if colon cancer is caught early, or if polyps are found even before they become cancer, that people's lives are saved. So we want to make sure that the pandemic fear of the virus doesn't stop people from this life-saving procedure, and people are now coming back to get it. We're probably up to 85% of screening colonoscopies that we were doing before the pandemic.
So would you say, where would you put us regarding COVID? I mean, are we in like the 8th inning, the 7th inning? Where would you say we are, do you think, with COVID?
Well, it's so hard to say. I was listening attentively to Dr. Bailey. The warm weather months are upon us, just about. And as we get back outside, we know that the transmission is less out of doors than it is indoors. But there is this bump in hospitalizations and bump in the test positivity rate that I think is making everybody a little bit nervous. I don't think we have a great explanation as to the cause of the bump. I guess the biggest concern would be if it was from some mutation in the virus and we weren't yet picking up the fact that it was a different strain of the virus now that was causing the problem. The easy answer is that people have let their guard down. I personally don't actually see any major change in what people are doing. So it's a great question. I wish I had the answer. If you had asked me about 10 days ago, I would have said I think we're in the 8th inning. Today, I'm not so sure. Maybe we're headed for extra innings.
Dr. John Chessare, when it comes to, and Brian and I talk about this all the time, people wanting to get the shot, the dose, it seems to be increasing nationally. Are you seeing more of a demand as more people know their friends are getting it, your employees are getting it? Are you seeing more people want the shots?
I think generally, yes. I think as time goes on, some of the vaccine hesitancy goes away when people see that their friends and neighbors got the shot and now they're fine. So I do think there are some people who originally didn't want it who now want it. I also know that there is a huge demand for people who have not yet reached the age criteria for getting the vaccine. I'm very excited about the Johnson & Johnson vaccine coming into Maryland in large numbers in a week or so that we can speed up the rate of vaccinated Marylanders. As Dr. Bailey said, that is the best single way for us to get out of the pandemic, is to get more and more people immune to the virus. more and more people protected against death, even if they could still get the virus but not get very sick.
So when you look at this past year and what you went through in the hospital and obviously the country, but when it comes to medicine, what will change? What do you think will come out of this for consumers and for you as well as a provider?
Well, I've reflected a lot. I used to look at people wearing masks in airports 4 or 5 years ago and think that was silly, and now I realize I was the one who was wrong. These masks are preventing infectious transmission of any respiratory virus, the common cold, influenza. So I think we're going to see people wearing masks at least during cold virus season, even after the pandemic. Not everybody, but many people will. Telehealth, and I know Dr. Neary Cohen's going to talk to you about that in a few minutes. Clearly, and I was a practicing pediatrician, I now look back wishing I had the option of telehealth for a lot of follow-up visits. It would have been so much easier for the parents of my patients. I really just needed to be reassured that the child was getting better. I really didn't need to do the physical examination on a lot of those. So telehealth is here to stay. I think the public health system is what has the most opportunity for learning. We know the CDC is fabulous, but just one layer below the CDC is very, very weak in our public health system. We've underfunded it and underdesigned it. And then allowing every single state in the union to do things differently, it just raises the question, is that really the best way to go? Would we be better off with some kind of a planned national public health system?
President and CEO of GBMC Healthcare System, Dr. John Chessare, we truly appreciate your time and once again, the relationship that we have with these ongoing virtual town halls. Thank you so much for your time.
Great to have you on, sir.
Thank you so much for having us, guys. Bye-bye.